video, I'll be demonstrating how to do a chest tube dressing change. So just a few notes before I start. I'm recording this at home where I don't have a bedside table or a bed that I can raise at a good working height. So if I was doing this while standing up and the patient the bed and the table were low, it's not gonna be good for my back. So for the purposes of this video, I'll do it while sitting down. However, in the real clinical setting, what I'll do is I'll use a bedside table and I'll raise it at a good working height, so above my waist, and then I will make sure that it's clean, and that's where I'll set up my sterile dressing tray. And then for my patient, I'll raise their bed at a good working height as well, above my waist, and then I will make sure that they are in a semi-Fowler's position, and that I will ask them to raise their arms so that I can have a good view of their chest tube insertion site. And then I'll also note that I'm recording this in a small room, so my space is very limited. So we'll start. First thing that I'll do is check my physician's order, and then I will do hand hygiene and enter my patient's room. Hi there, Mr. John. My name is Alex Cruz. I'm a year 3 student nurse at the University of Manitoba. I'm here to change your chest tube dressing. Is that okay with you? Our patient would say yes or no. And then can you just please tell me your name and date of birth so I can make sure that I have the correct information. And then I would check their armband as well while they're saying their name and their date of birth. And then Mr. John, I just want to explain the procedure to you. So what I'll do is I'll remove the current dressing that's on right now, and then I'll clean the site and assess it, and then I'll put on a new dressing. Does that sound like a good plan? Our patient would say yes or no, and if they agree, we can go ahead with it. So then I'll just take a couple of minutes to get set up here. I'll do, Mr. John, I'll do hand hygiene before I set up my dressing tray. This will go into the garbage. And then I want to make sure that I'm only touching the 1-inch borders of my tray. And then here I will grab my forceps. So then just note that this was from my previous attempt. So then I will grab the garbage bin, and then I will set this up over here. And then this I won't be using for this video, so I'll just set that aside for now. And then we'll add our supplies. I'll add my drain sponges, and then I'll put this into the garbage. I'll add my 4x4 gauze, as well as my Gelonette. So just note that I use this for practice already. There we go. Okay. So then now that I also add my normal saline. So when we're adding this, we want to make sure that we don't make any spills, or we want to make sure that we don't touch anything that is on the tray. And then I'll do hand hygiene again, and then we'll take off the old dressing. So then when we're taking off the old dressing, I'll just move my patient a little bit. We want to make sure that we are peeling gently so that we can prevent accidental removal of the chest tube. And then we also never want to use scissors to take off the dressing on chest tubes. Okay, and then we can also stabilize the tube with our other hand. And then I'll remove this. And then this will go into the garbage as well as my gloves. We'll pick it up later on. Then we can use our forceps to grab the old Gelonette. We will throw that in the garbage. And then now I will do hand hygiene and then put on my sterile gloves. We'll set this aside. Okay. And then I'll put on this glove, and I'm only touching the inside portion, so the portion that's going to touch my skin. And then for this one, I'm gonna touch the inside portion, so the sterile portion, so sterile to sterile. And then I'll just move these stuff here for now, and then I will clean the insertion site. So we want to clean the whole 360 around the tube, and then we want to start from the skin closest to the insertion site and then work our way outward. Okay, so then start here and then work in circle, and then we want to do one swipe per gauze. We'll soak that in normal saline, bring out the excess, and then we can clean the outer part. Like I said, work our way outwards. And then I'll clean one more time. So then next, I'll clean the tube itself. We'll clean the top and bottom of the tube, and then same thing. We want to start at the insertion site and work our way outwards. So start here and move down, and then we'll clean the bottom. So I'm making sure that my forceps is not touching the tube. So then next thing that I'll do, I will dry the I'll dry the skin. So same thing, start from the inside, the skin closest to the insertion site, and work your way outward. And then we'll dry the top and bottom of our tube as well. So from the insertion side, work your way down. So I'm making sure that my forceps doesn't touch the tube. So then now that we cleaned and dried it, we can assess the site. Look if there is redness, swelling, if there is drainage. And then also, I forgot to mention when I was removing the old dressing, we want to assess the dressing too for any drainage. If there is, what color it is it serous sanguinous, purulent, the amount of drainage, so how saturated the old dressing was, and also if there was odor present. And then after we clean it, we want to do the same thing, assess it, if there's any drainage, redness, swelling, if there's maceration around the skin. And then next thing that we'll do is we'll put on the Gelonette. So we'll remove this. we'll set this here for now. We'll dispose of it later. And then we'll shape the gel in it, and we want to put it on the tube. And then we want to make sure that the insertion site is fully covered with the Gel-A-Net so that it is fully occlusive. And then next, we want to cover it with the drain sponge. So then we want to cover it. With 2 drain sponges, and we want to make sure that we put them in 2 different directions. So I'll do this. So I'm only touching the drain sponge. Okay, there we go. So then now I'll cover that with a 4x4. And then I can use my gloves where we don't need to be sterile anymore. I can use my gloves to cover that with a Meefix. And then we want to make sure that the Meefix is covering the whole 4x4 and that it is fully occlusive. And then we also want to make sure that we tent the Meefix around the chest tube. And then you'll notice that I put a date on here so that the next nurse will know when the dressing was changed. Same thing, we'll tent that on the chest tube. Make sure the dressing is fully occlusive. And then I'll just chart on my IPN as well about the dressing change. And that's it.